From WFRV TV Local 5, your local election headquarters, this is Newsmaker Sunday with your host, Tom Zalaski.
Good morning. Welcome to Newsmaker Sunday. I'm Tom Zalaski. September is Suicide Prevention Month in Wisconsin. According to the State Department of Health Services, 886 Wisconsin residents died by suicide in 2018. Nationally, the rate of suicide is the highest in middle-aged white men in particular, and in 2017, firearms accounted for more than 50% of all suicide deaths in America. And this morning on the program, we welcome in Jean Rivette with St. Norbert College and Aaron Bongers, a public health nurse with the city of Green Bay, and we DePere make that, and we thank you both for joining us this morning on Newsmaker Sunday. Tough topic to talk about. Jean, when a suicide happens, it has a wide-ranging effect on the community, does it not?
Absolutely. I've experienced suicide 3 times in my life.
In your own personal
experience? In my own personal experience. So it really, it's kind of a ripple effect. So when someone commits suicide, you're left with a lot of unanswered questions, but a lot of doubt, a lot of grief, a lot of trauma. A lot of different mixed emotions.
Well, as a nurse, Aaron, what do you look for? Looking for signs of someone who may be considering taking their own life.
Sure. So as a public health nurse, our role that we're trying to do is really work on prevention, and we talk about something called QPR, which we call as like the CPR of mental health. So trying to train people to look for those signs. If somebody was, not acting their normal self, seeming depressed, not doing their normal routine. And we educate our community on these different signs, so then the QPR stands for question, persuade, refer, and that they can then try to question those loved ones or friends or family that they notice with these symptoms or behaviors that are out of their normal, and then persuade them to get help, and then refer them to get help. So we call it the CPR of mental health, QPR.
Jean, what do we do for someone, advice for someone who has quote-unquote lost all hope?
I would suggest anchoring themselves pretty much in the community, which I kind of took an active role in. There's so many resources, so many opportunities to get involved, and I think just anchoring yourself into the community some way or some manner.
How do you mean anchoring yourself in the community?
It's giving back. It's the awareness process. It's about doing, I lost my brother in last August, and I said, I'm going to turn this into something positive, something negative into something positive. So,
Aaron, there are struggles now, a new type of struggle with farmers. Mm-hmm. Farmers are having to face tougher times than they have ever faced before. How big of a crisis is it now in rural areas?
We are seeing an increase. So what we're doing as a coalition, and we're on the Brown County Coalition for Suicide Prevention, we have different subcommittees that are trying to focus on those areas, so we can look at that data and research and see what we can do as a community to try to help and prevent those things and connect people to resources so that they are not having those feelings of depression and just getting the help that they needed.
We're talking about depression in this. Jean, depression, it's a key factor here. Some people turn to alcohol. Some people turn to drugs. It's essentially substance abuse. What's the connection between suicide and substance abuse?
Good question.
Or is there that we know of?
Boy, I don't know. Are there any statistics on that?
Well, I would say that, substance abuse and depression go hand in hand. Our working in public health, we do the community, we have a mental health task force. We also have a drug and alcohol task force. Those are two very, we call it the Community Health Improvement Plan that our community has focused on. Community partners, public health, hospitals, all different organizations come together because we do see link in those things. So we're working on different tactics to try to make positive change, move upstream so we can decrease those issues. But as far as stats and things, but we do see connections with mental health
Sure.
and
And the farming community.
yes.
And even though I'm working in the television business, I've got to believe that television right now and music especially, it's not helping matters any for some of these people.
I think it's hard you know, what we see and hear and social media and things, it puts a lot of pressure on all of us, youth to adults, everybody. I think it just...
Yeah, I think it's a societal issue too, because I think there's some statistics out there that state something to the youth. Youth are on their phone all the time. There's a high rate of suicide with kids using their cell phones, being on the internet, being so that there's a proven fact that that's going on right now.
Yeah, that's a good point. And they also say, kids have the more ability to be connected to everybody with the social media, but they're more socially isolated than they have been before because they're so connected to those devices. They're losing that eye-to-eye contact, that one-on-one, because they're removed from that. They're on their phones or their electronic devices so much. So.
And for someone going through a tough time, with the social media, you look on Facebook and everyone seems to be doing so wonderfully. My life is so great, and the person going through a tough time looks at that and says, why can't I be like that?
Absolutely. I think that can be very traumatizing for everybody of all ages, because it does pose this almost looks like a perfect life for everybody, and you're comparing yourself to something that isn't always true when you know that people post things that might not always be.
Sure, because I do that.
Yes.
I look at Facebook and I go, why are they doing so well? Where did I go wrong? And so you just can imagine somebody who's really having a difficult time when they see that. Gene, Federal Communications Commission, they're working to institute a new 3-digit phone number, 988, to access counselors. What do you think of that idea?
I love the idea. Actually, they're incorporating into the high schools now, I believe. On the student ID cards, they are putting the hotline for crisis center suicide hotline. So
on high school ID cards?
High school ID cards. And we're trying to incorporate that, I think, into the colleges. I think St. Norbert College actually is starting to implement that, or starting to talk about. It's called medical or first aid, I think.
Mental health first aid. So what's amazing about that is, we have been talking to the Mental Health Task Force, the Brown County Coalition for Suicide Prevention, and local colleges, St. Norbert College. They're looking at implementing a thing called Mental Health First Aid. It's a program. It's basically training it would be training all the college students, kind of like when you get trained in CPR. They would go through this training, and then every student would be trained in the college, so upon graduating, they would all have more awareness to mental health needs and be able to detect or see,
identify where there's problems.
Yes. So they're looking at implementing that in colleges across. I think Chicago has it implemented in some of their schools. So that's something they're working at in the college level. As the high school level, we were just talked about at our coalition yesterday. One of our members brought up that having, I believe there was another school in Wisconsin that had like Jean had said, the local numbers for like the Hope line, the suicide prevention line, on the back of their ID cards. So they would have that at all times. So we're looking as a county and a coalition and the task force to maybe implement that as a county-wide thing. So maybe next year we could possibly get that on all student ID cards throughout Brown County.
We usually talk about suicide in terms of adults, but this trickles down into college and high school these days, does it not?
Yes. Unfortunately, suicide is the second leading cause of death for young people, ages 15 to 34 in Wisconsin.
Yes.
So it's alarming, and it's something that is a public health concern, and for all of us as community, we need to come together and do things to make a positive impact to change that.
We're just trying to reduce the stigma too behind these statistics. So,
for either one of you, for the counselors, what kind of training does a counselor have to go through when they're in charge of a hotline, so to speak?
I don't deal with that.
Yeah, and I don't, but I do know, like at the crisis center and the lines, that the Hope line, those the resources that are available are all trained credentialed counselors. As like Jean said, I'm not sure exactly their credentialing, but they are professional counselors that are trained to help those people. And we have some wonderful resources here in the county.
And that can be tough to be receiving those calls,
Absolutely.
to be on the receiving end. That can be overwhelming if you're not trained properly.
Yes, absolutely.
Yeah, that's one of the cases I think they talk about is more mental health professionals need more training in, you know, addressing suicide and behavior of suicide. And so, yeah, that's one of the pitfalls about it. So.
And we do have a wonderful, it's called Connections, and it's a mental health website too that has all of the links to the mental health and substance abuse info, recoveries, service navigation for Brown County, Calumet, Outagamie, and Winnebago County. So it's kind of the go-to to find any mental health needs that everybody can have access to. So we utilize that quite a bit now. That's a really positive link in our community.
We are talking suicide prevention, and we're back with more right after this, so please stay with us.